Well, good morning and welcome to Sonoran Living Live. We're starting a little bit different this morning. We're going to tell you a little bit more about what's coming on in the show as the show progresses, but I want to start with the health zone this morning, and I want to start with pain, because when you have recurrent pain, it not only makes you physically uncomfortable, but it also takes a toll on your mental well-being. So as we look at ways to improve our health in today's Health Zone show, we want to turn our attention to our sponsor, Dr. Eric Feldman from the Core Institute, for his take on how to either eliminate it or manage pain, because it's so important to people that do suffer from it. Welcome to the show. So glad to have you.
Thanks for having me. It's great to be here.
So tell me how it is that you are able to manage pain for patients when they come into the Core Institute.
So the patients who come in to see me are patients who primarily have chronic pain that's been there for greater than 6 months usually. But anybody who's been having pain can come in with pain. Even someone who's been having pain for 2 or 3 weeks is an ideal candidate. And so the main patients I see are patients who have pain coming from the musculoskeletal system, primarily back or neck problems. But I also see patients with fibromyalgia, any type of chronic nerve pain, and just pain in general is going to be the ideal candidate for me to see.
So you've brought this I'm not a doctor, clearly, but are you kind of addressing some spinal cord pain here?
Yeah, again, the majority of the pain I see is going to be spinal pain, and today what we're going to talk a little bit about is something called a spinal cord stimulator. It's a device that's been around for many years, but it's really become much more sophisticated and effective over the past 5 to 10 years. And so basically this is a device that's going to be used for someone who has chronic severe spinal pain, and oftentimes with sciatica, which is the pain that shoots down the leg or down into the arm.
Yeah. You know, I had that when I was pregnant, and is that kind of spurred by certain things? Because I don't have it when I'm not pregnant, and then I did, and it's debilitating. I can't imagine people that live with it, you know, endlessly.
Yeah, absolutely, and most patients who have this type of pain, it kind of comes and goes, but for those patients where it becomes chronic daily and they're debilitated by it, this is something that we can use for the right patient to effectively block those pain signals and get them back to a more functional quality of life.
Well, tell me more about this little piece, because this is really kind of the key to the Core Institute, is it not?
This is, yeah, and a very important part of what we're doing with the spinal cord stimulator. So this is kind of like a pacemaker. It's actually smaller than a pacemaker, and this is the battery pack that's going to be inserted subcutaneously, which means just underneath the skin. And really, this is the only surgical part about it. This is a lead. It's an electrode, and it's going to be implanted just next to the spine. And basically, this is more of a surgical one, and this is one that's implanted actually through a needle. And basically, what it does is it's going to be inserted right up next to the spine, and
so,
it's going to,
like we see right here.
Yep.
Okay.
And so basically, I'll take this one from
Sure.
you, and I'll show you. This would go through a needle, and it would just be placed up right under the bone, right next to the spine, and it's going to block those incoming pain signals so that before they get to the brain, it's interpreted more as a pleasant, warm, tingling sensation as opposed to a debilitating, a painful signal.
Now, obviously, if you're suffering from pain, most people will go to any lengths to be able to alleviate that. However, they don't want to add any discomfort unnecessarily. So what is kind of the discomfort level through this procedure to get, of course, the end result, which is pain-free?
You know, when we're actually doing the spinal cord stimulator implant, it starts with a trial, and that's the nice thing about it, because it's really no more invasive than an epidural steroid injection, in which a lot of these patients have been through before. So we give them a little bit of sedation. They're very nice and comfortable. We use a lot of local anesthetic or numbing medicine, and so patients are not in pain when we're doing the procedure. Then we want to kind of bring them out of the sedation and test it, and we program it, and we say, are we covering your pain? Are we getting rid of your pain? Are we covering all the places where you have pain? So it's really not a painful procedure to have this done, and it takes anywhere from about 30 to 60 minutes to do the actual procedure.
So about an hour, let's say up to an hour to do the procedure. How quickly do they get pain relief?
It's basically immediate. You know, we have a programmer from the company who's programming it, and once they get kind of that sweet spot, people say, yep, that's my pain, and we got it. So
what do they say in terms of the quality of life after they've undergone this type of wouldn't be a procedure. What do you call it? It's like treatment?
Yeah, I mean, it's an outpatient procedure.
Okay.
You know, it's remarkable. For the right type of pain, it can change lives, and that's what we do in pain management. We're striving to improve quality of life, and so for these patients who have chronic pain, we're using different modalities to try to improve quality of life, and this is a very effective one, and it's one of the more exciting ones in our field. And
lastly, how long can we expect that something like this would last, or would there be some sort of maintenance?
It's permanent, but what you're doing is you have to charge the battery, which depending on the battery, it can be once a week, sometimes a little less frequently, and really, other than charging the battery, that's all you're going to have to do. Every 7 to 8 years, you probably have to replace that battery, which is a tiny incision just to remove the battery pack, and you hook up a new one.
Okay, so this is a lifelong sort of investment into your health.
Exactly.
All right, covered by insurance?
Oh yeah, most insurances, if not all, will cover them. It's just getting the right indication. So that's what your doctor is going to do. Make sure you're the right patient to have this done.
And that begs the question. I know I said lastly, but it begs the question: who is the right patient?
So typically the patient who has chronic back or neck pain with that nerve component, the pain shooting into the arm, shooting into the leg. And again, you know, someone who's suffered from this, that they've tried other modalities, they've tried physical therapy, they've tried the other types of things we can offer them. And if nothing seems to be working, then this is a real good option.
Thank you so much. I feel like I learned so much about this here in the last 5 minutes. Appreciate you being on the show.
Thanks for having me.
If you would like to schedule an appointment with one of the fellowship-trained physicians at the Core Institute, you can simply call 866-974-2673 and check them out online at thecoreinstitute.com.